Okay, so here goes the cancer update. It's pretty involved, and boy, I'm not really sure if I should tell you about the 30 hours down at Rochester Mayo Clinic or what I should be sharing, but I guess I'll cut to the quick, and I'll say that the Mayo Clinic initially wanted to do surgery, then radiation, then chemotherapy, but it turns out that the tumor is growing along the whole backside of my tongue, which means that if they were to do surgery, they'd have to cut out the tongue, and that's no bueno, so we aren't going to do that. The Mayo Clinic has this treatment that's called the proton radiation, and I shared a little bit about that, and I think that there is a link around in here somewhere. It's cutting edge stuff, and they are saying that I qualify for that, and it would do much less damage, and it would be much more efficient. So the thing about this is that if I go to the Mayo Clinic, they offer a housing, it's Hope Charity or something like that, where they give a person apartment. The problem is that I'm told that in weeks 5, 6, and 7 of radiation treatment that the side effects of the radiation can get so debilitating that some people can't take care of themselves, and if you can't take care of yourself while you're in one of these apartments, they put you out because it's not assisted living. So what I'm in the process of doing is, first of all, making sure that I can get approved by my insurance company to do the Mayo Clinic treatment, and then secondly, trying to figure out how to get somebody that would be available for staying with me during those 3 weeks. So that's my strategy for now, and or not my strategy so much as my strategic efforts are pointing in that direction. Now the other thing, and this is good news, bad news, is that the GoFundMe page was all about getting the Gerson protocol treatment that initially the one I was looking at was in Mexico, in Rosarito. And that was too pricey, and the GoFundMe page wasn't going as well as I had hoped, and I'm starting to think that maybe I had excessive expectations, because people have been very, very generous, and thank you all for the money and the words and the well wishes, and it's really lovely. So there's that. With that said, I thought that maybe my story would be able to get out to the general public and generate some goodwill, but that doesn't seem to be happening. So, oh well. The bottom line is that my bottom line is not as strong as I would want it to be when considering the cost of these treatments. So I will continue to leave the GoFundMe page up there, and I hope that people contribute, and maybe it will become like appealing to the public, and it'll take off. Wouldn't that be nice? I'm doing different things that are meant to strategize that, but who knows whether they're going to work or not. In any case, we'll see how it all shakes out. Meanwhile, I did find a Gerson protocol place in Elk River, and that I've started. So I've already begun that protocol. It's about half, well, it's 20,000 compared to the 40,000. I only share this with the viewer because I'm still essentially begging for money. And I don't mind begging for money because, man, I've given tons away, so you know, maybe a little of what comes around goes around in a good way for old Dakota. So in any case, however it shakes out, I'm sure that what's supposed to happen will happen, and that's what I hope for. Whether, no matter what the outcome is, what's supposed to happen, I imagine will happen. And so, as I move forward, I'm getting the Gearson protocol, and I'm hoping for the treatment at the Mayo Clinic. Now, the reason that I've succumbed to the idea of going with the radiation and the chemotherapy is this. The good doctors at the Mayo Clinic told me that if I wait as little as a month before getting this treatment, to forget it, that game's over. And so if I'm going to work towards being healthy again, it's going to pass through some pretty crappy stuff, like burns to the throat and taste buds going out and saliva glands being lost and whatever. So, and by the way, listen, here's the thing too, is that I say these things to be informative. Please, please, if you know me on a personal level, this is not to solicit pity or sympathy. I've got no room for that. This isn't what this is about. I don't want, I mean, it's really uncomfortable when people give me a sense of pity and sympathy and that kind of a thing. I mean, I know it's coming from a good place, and I can't fault that. Just, you know that I'm not looking for that. So, with that said, I'm pretty optimistic about the way things are going, and I'm looking forward to doing this YouTube channel and getting subscribers. Maybe 5 years from now, monetizing this thing. But in the meantime, that's 5 years of good advice that I plan to provide for you, dear viewer. And that's my story, and I'm sticking to it. All right, bye-bye.